Hello, my friends. My name is Dr. Adepero Okulaja, aka More Than a DR Dot. I'm going to be talking about some unusual signs of heart attacks. Unusual signs of heart attacks that we need to watch out for. Now, a lot of people have watched movies and they've seen people clutch their heart or clutch their left shoulder when they're having a heart attack and start breathing heavily and perspiring. And we know that those are not good signs when they occur, especially with activity. But there's some subtle signs that can point you to the fact that your heart health is not what it should be, especially as it pertains to an acute MI or heart attack as it is commonly known. And these phenomena, these symptoms, people don't pay attention to them in terms of the fact that they feel that they are as a result of symptoms from another system in the body. And you'll understand what I'm saying in a minute. But because of that, they don't pay attention to it. I'll illustrate my point by telling you a story about a patient that I saw many years ago. She kept coming into my clinic and she would say that she was short of breath and that she would have these episodes of nausea. And we did the usual GI workup for her, gastrointestinal, that's what that means. We checked her to see if she had any disease in her upper GI, and there was nothing. There was nothing that we could pinpoint that was wrong with this woman from a gastrointestinal point of view. But she would say that, I'm fine, but when I get up and when I walk and when I'm moving around, I just can't seem to get control of my reflux symptoms. And so one day I was just looking at her. She had seen various specialists and she was coming back to me as a primary care physician to discuss this pesky problem. And I just looked at her and I said, Jay, I'll call her Jay. Jay, heart disease in women present in very unusual ways. I'm going to get a stress test on you and let's see what comes out from it. And a stress test is when you have a person exercise and look at the response of the heart and the heart movement to see if there's a part of the heart that has compromised blood supply. And so my patient Jay went for her stress test, and I was questioned by the cardiologist at that time. Well, she doesn't have any cardiac symptoms. I just want to make sure that there's nothing wrong with her heart. She went in for her stress test, and her stress test was positive, which means that she had a part of her heart that was not getting enough oxygen. And so I then sent her to the cardiologist, and they did what we call an angiogram of the heart, and they found out that she had a 99% blockage in one of the large arteries supplying the heart. I was flabbergasted. I was like, whoa, this is huge. So I started paying attention. And even though I knew that certain kinds of MIs or heart attacks can present in a certain way, when it presents subtly, sometimes it's very difficult to pick it up. Now, this happened to me about 22 years ago, and since then, I'd like to think that I'm a bit smarter. So I pay attention, and I tell my patients to pay attention. If you are a person who has a strong family history of heart disease, that is, you have a family member that died suddenly of unknown reasons, a family member that has had strokes or has had a stroke, multiple family members that are on cholesterol medications, multiple family members that have high blood pressure or type 2 diabetes, you are at increased risk for cardiac disease, even if you do not deal with these issues yourself, and you have to be very careful. And if you deal with these issues, you have to be doubly careful. So what are the symptoms that I'm talking about? Of course, if you start exercising and you find out that all of a sudden you're not able to exercise as much as you have been in the past, you need to go see your doctor. If you're exercising and you develop any kind of chest pain or chest discomfort or difficulty breathing, you need to go and see your doctor. It doesn't mean you have heart disease. It just means that you need to go talk to your doctor. If you start exercising and you have any kind of symptoms in the upper abdominal area, you need to talk to your doctor. Now, let's talk about the acute presentations. A person is sitting down and they suddenly get up and they start moving, and all of a sudden they get this heavy pain on the chest, in the mid-sternal area, we call it. You need to get to the hospital ASAP. It may mean that you are having a heart attack. Now, again, if you have chest pain and it is heavy or not heavy, and it's associated with certain symptoms like pain radiating to the left shoulder or pain going up the neck and to the jaw, especially in the case of women, you need to get to the emergency room immediately. You may be having a heart attack. There are other subtle symptoms, and those are the ones that I want to concentrate on today. If you start exercising and you all of a sudden feel sweaty, you never used to feel as sweaty, but you start feeling sweaty and you start feeling uncomfortable, you have a sense of doom, you need to go to the hospital immediately and get checked out to see if you're having a heart attack. If you suddenly develop nausea, a feeling of being sick to your stomach, you want to vomit, and you are sweating, maybe it's on a hot day, it doesn't matter. I'm talking about the people in less temperate regions now. And even if it's in the temperate region, you're not supposed to be sweating, and you all of a sudden feel sweaty and this feeling of nausea and a sense of doom with just doing a little bit of exercise, or it even catches you at rest, especially if it's accompanied by chest pain and pain radiating into the jaw, or just a feeling of not being comfortable in your own body, you need to get to the closest emergency room immediately. Immediately. Do you have a friend, a brother, a sister, an auntie, an uncle, any relative, and you're seeing that the way that they are moving cardiovascularly, I mean when they walk and when they exercise, is not the way they're supposed to, or is a change from before? Please have them go to see their doctor. Have them make an appointment. So in wrapping up, there's some unusual signs that can come that can be an indicator that someone is having a heart attack, and not only chest pain, not only pain radiating to the shoulder, not only pain radiating to the jaw, but sweating and intense nausea and sometimes vomiting. Present to the emergency room immediately. Thank you so very much for listening. Pass this video on to your friends. Pass this to your loved ones. And remember to watch my video that I did before about why men are suddenly dropping dead. It's very important. It may save a life, yours and another's. Thank you so very much. Have a great weekend, and I'll see you soon. Bye-bye.